Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She's the administrator of the Champaign-Urbana Public Health District. Julie, in the morning when I grab my phone and I look to see what the latest numbers are and where we are with COVID these days, I don't expect for you to also be a weather person, but because of you, I know that we're going to have sunshine all week. So thank you for that post this morning.
You're welcome. It is, I love that the Weather Channel or the local weather put it on as a sunshine warning. I thought that was very cute. So
More good news. Johnson & Johnson has now been approved and we have a third vaccination. Do you know at this point if that vaccine is headed to this county?
My understanding, we will have it within the next 2 weeks, possibly as early as the end of this week.
And it's kind of like you learn in elementary school, you get what you get and you don't throw a fit. So whatever is offered to you, you take it.
Correct. You do not request a specific kind of vaccine. We do it, we are trying to get as much vaccine out as possible. So we're doing clinics with one vaccine at a time. So it's not like you can go someplace and select a vaccine. And that way it helps with the second dose vaccinations as well. So of course the Johnson & Johnson won't have a second vaccination. So that will be convenient as well for some people.
As of Saturday, I wrote down the numbers for where we are with vaccinations in Champaign County, but those numbers are now wrong because your office is constantly putting this vaccine in people. Do you have the most updated numbers as of today?
I do. So, and actually Carl had weekend clinics, so that was great. We have, okay, well, this is going to be constant. So we have 16.04% of our county currently fully vaccinated. That is 27,717. And we have another 44% of our county have received first doses, and that's 76,681. And today we're doing another 1,200 over at iHotel second doses. I believe Carl's doing second doses as well. So we continue to get these numbers up all the time.
According to the CDC, the new question is this variant is headed here. We could have another wave. I think it would be the fourth wave of the virus. Are you worried about that? Another resurgence in the spring, even though we have numbers under control right now?
Well, I'm less concerned about it in our county than I am other places, but certainly, just kind of like I've said all along, our county can do a better job and not have such an impact of the spikes like we didn't around Christmas and Thanksgiving like other places did. So, we still need to keep doing what we're doing, but I am super happy with how the vaccination's going. So the more people that get vaccinated and we keep doing our, masks and distancing until we get everybody vaccinated. And so I'm actually not that concerned about it. I'm hoping that we continue on like we have been doing, and that will be great.
Let's talk about the vaccinations right now, because I have a lot of friends that are not in the pre-existing category. They are maybe in their 38 to 48. They don't know if they're eligible. Who currently is eligible and where can they get vaccines?
Okay. First, I will start with who's eligible. I will go over that, and I'm going to read it because I want to make sure I get every single thing included. Well, actually, I can say where you can get vaccinated. Every Walgreens in our county right now is doing vaccination. You have to fit into one of the categories. Carl out at Dress Barn is doing mass vaccination clinics. Public Health is still doing them. Francis Nelson or Promise Healthcare is doing them. Christie Clinic will be doing them. OSF was doing vaccinations up in Rantoul. So you just need to keep an eye on the websites and, look for when we open up new appointments. We're not getting as much vaccine right now, first doses, as we have been. So, for example, today we opened up all these appointments countywide and they were filled up within less than an hour. So, but we're going to continue to do outreach clinics to try to reach those who we're not reaching. For example, today CUPHD is out in the senior apartments. They're not congregate living in the same sense as, a nursing home or assisted living, but they still have individuals out there who may lack transportation and need to get the vaccine. So lots of places to get vaccinated in our county. As with everything, it all depends on how much vaccine we get each week into the community. And that's why each week you see new slots opening up. But right now, everyone in Champaign County who lives here are eligible if they're between 16 and 39 and older with underlying health conditions. Those include cancer, chronic kidney disease, COPD, which is chronic obstructive pulmonary disease, diabetes, heart conditions, immunocompromised from solid organ transplant, obesity. And again, obesity is a clinical term. So we're talking, BMI of 30 or more. Anyone who's pregnant, anyone with pulmonary disease, sickle cell disease. So those are the main categories. And then also eligible are anyone who is healthcare personnel in hospital or non-hospital settings. And that is also includes, anyone working in hospitals or healthcare settings. Residents 65 and older, everyone in that. First responders, corrections officers, anyone working in education, early childhood, state-approved early childhood or licensed daycares, K through 12 schools, essential frontline workers who work or live in Champaign County, and that includes grocery store workers, baggers, checkers, stockers, pickup, customer service, food and agricultural workers, that's processing, plants, veterinary health, livestock services, animal care, adult daycare workers or people who work in shelters or live in shelters, postal service workers, and that also includes UPS, Amazon, FedEx, all of those. Manufacturing workers, industrial production of goods or services designed for retail, wholesale, or manufacturers, and public transit workers. That's flight crews, bus drivers, train conductors, taxi drivers, paratransit, in-person support, and all of the ride-sharing services. So, Uber and Lyft and all those. So that is the categories that we have open right now. That is a lot of people. A lot of people qualify under those.
Statistically, minorities are getting COVID at a higher rate, but somehow we're statistically vaccinating minorities at a lower rate. Is that lack of access to clinics that are vaccinating? Is that mistrust of the vaccine? Or why are we again failing minorities with this?
That's pretty much all of the above. So what we're doing in Champaign County to make sure that people are getting access to the vaccine, we've used a lot of key informant leaders in the community, African American and Latino communities, for example. We're working with the Congolese community, Guatemalan community as well. We have lots of community partners, and we are working to figure out the best way to get the vaccines out, whether that is in community centers, in neighborhood clinics, in churches or religious organizations. Whatever is going to be the best, most convenient way that we can get the most people vaccinated is what we're going to do.
Currently in Champaign County, our numbers are down. They are better than they are in not just parts of the state, but a lot of the country. Where are we right now with our numbers locally?
Well, we are doing a lot better right now. We have 330 active cases, which is a lot lower than it's been for a long time. 436 in quarantine. Our positivity rate is 2.9%. We have 12 Champaign County residents who are hospitalized, and we've had 129 deaths. So while our numbers are lower and people are having access to the vaccine, I need to caution people that they need to understand that this is still, it's the disease is still out there. It's still serious. It still spreads rapidly, or possibly even more rapidly than before because of the variant. And people are still dying from this and being hospitalized. So we need to, if you're not fully vaccinated, you really need to understand that you're still at risk.
There are people out there called ventilation experts. Who knew? I didn't know that, but they are going into schools and giving recommendations, going into nursing homes and giving recommendations. Is that the key as we get to the spring, is to ventilate and open? If you have to be inside with other people, open the windows, mask, stay apart from each other, but ventilation is a big key?
Well, yeah, ventilation is always, a good idea to have a lot of, air exchange so that you're bringing in fresh air and getting out the stale air and the potentially contaminated air, if you will. But yes, if you're going to be inside with people who aren't vaccinated, you're not vaccinated, you need to wear your masks and keep your distance. And even if you are vaccinated, while you may be protected, there is still the possibility that you could spread it and not know that you have it. So you could be infected with the virus and not know it, and maybe be breathing it out. So in order to protect those who are not vaccinated yet or fully vaccinated, you still need to wear your mask around them.
It's been almost a year to the week that we detected.
Really, just 1 year? It seems more like 10, 12, something like that.
It does. My gray hair can speak to that. What would we have done differently if we had reacted sooner? Or can you just kind of reflect back to a year ago and where we are now?
Well, I mean, what I would have liked to have seen is a nationwide response that was the same, that we were, everybody was on the same page. States were not fighting each other for resources. There was basically the pandemic plan had been followed. That would have allowed much quicker response times on everything, everything from Defense Production Act to everything. The one good thing is that the vaccine, there was a ton of money put into getting the vaccines up and going really early, and that was helpful. But again, if the messaging would have been the same and it wouldn't have been politicized and there wouldn't have been this weird idea that the virus or the response, the public health response, was somehow a political thing, I believe tons of lives would have been saved, because the prevention of this is relatively straightforward and relatively simple. You do the masking and the distancing until you can get to a vaccine and get yourself fully vaccinated. And that really has been what it's been all along. But there's just misinformation epidemic that has really hampered, I think, a lot of efforts. And it really is tragic.
I'm not going to make you go over the list of people that are eligible. It starts with 16 and up with pre-existing conditions. Where would somebody go if they're just tuning in late? What website, what phone number could somebody call in order to get this information to see if there's eligibility for them?
Well, if you're 16 up and up with one of those underlying health conditions, then you would just call into either Walgreens or the public health site when we're open up, or use the link, or the Carl site, or one of the other ones. We put out a press release usually about once a week, but you can always check on CUPHD's Facebook page, which is c-uphd.org. That's not our Facebook page, that's our website. And we keep the stats on there. And we also keep the latest press releases and information like that, so that people can read more if they're interested in it and read more about the conditions. And you may say, well, what's a pulmonary condition? You can, read on there and get more detail about that.
Since we talked last, we found out that we get 4 more years of partnership with Urbana Mayor Diane Marlin. So a huge congratulations to her for her recent election win. Jason Liggett, you are essential to keeping this information on the air. Thank you for all you do. Julie Pryde, weather person, CUPHD administrator, thank you so much for all that you do for this community.
Thank you. And that sunny outlook that I put on there today is also sunny outlook for the pandemic, I think, because we're headed toward lots more vaccination and lots more outdoor activities and lots more getting to see friends and family. So that'll be nice.
Thank you, Julie.
Thank you.